1 in 5 adults struggled with a mental illness in 2020, according to the federal government. This comes out to 52 million Americans across the U.S. that dealt with depression, anxiety, or another mental disorder. In a separate category are those with a serious mental illness, a disability that greatly affected quality of life.
Psychotic illnesses like schizophrenia or bipolar disorder or severe depression would be serious mental illnesses. And there are about 14.2 million people, roughly 1 in 20, who struggle with a serious mental illness or who have recovered from it, but the number that we think about in terms of prevalence.
That's Dr. Thomas Insel, a psychiatrist and neuroscientist. For more than a decade, Insel led the National Institute of Mental Health, overseeing where billions of dollars were directed for mental health research. He's also the author of Healing, Our Path from Mental Illness to Mental Health. Over the last 2 years, mental health care has been front and center as billions across the globe felt more isolated and uncertain in the midst of the COVID-19 pandemic. In adolescents in particular, experts have recorded rising rates of depression and anxiety resulting from a lack of routine, decreased social interactions, and other life disruptions. And when it comes to care, all too often everyone across all ages don't get treatment until they've reached a breaking point. Insel says that this is one difficult aspect of mental health. How do providers help people who may not want to be there?
If you have an anxiety disorder, by definition, you're avoidant. You don't go out and you don't seek help. If you're depressed, you're likely feeling hopeless and helpless. Very difficult to overcome that, to be able to seek care. And if you have a psychotic illness, you probably don't think you're ill. And so why would you seek care? So it's one of the insidious aspects of mental illness that these illnesses themselves will preclude treatment.
And the design of the mental health care system doesn't help. It's largely set up for reactive care rather than preventative.
We pay for hospitalization. We pay for emergency room visits. We pay for somebody who's in their most extreme moments. That's the most expensive and most intensive and probably least effective way to manage what are generally long-term issues that require a more consistent approach. What we fail to do in the United States is really focus on health. We focus on sickness. We have essentially a sick care system, not a healthcare system. And in mental health, what that means is that we are engaging people when they're least able to recover and find it most difficult to actually use the treatments that are available.
Many people also avoid seeking help because of the costs. Dr. Vale Wright says navigating coverage can be overwhelming and treatment can be costly depending on a person's insurance or lack thereof. Wright is a psychologist and the Senior Director of Healthcare Innovation at the American Psychological Association.
Across every nationally representative survey that I've seen that looks at barriers, cost is the #1 barrier to care, and that includes both lack of insurance, confusion about what insurance covers and what it doesn't, confusion about in-network and out-of-network situations.
Earlier this month, President Biden highlighted the current failures in mental health care during his first State of the Union address. When it comes to insurance coverage, he argued that mental health should be treated the same as if it were physical health. Coverage needs to be more robust, and Americans should be able to access these services more freely.
We need to be more innovative in the way we think about mental health and more innovative in the types of interventions and the preventative work that we do. So we need to be meeting patients where they're at in the community, in churches, in barbershops, in schools, and delivering treatments and preventative types approaches so that we're not just waiting for someone to have a diagnosis to get the treatment. We need to get to them before that, much like how we think about physical health care and the needing to get checkups ahead of time.
Wright highlights that there are new models being developed where physical and mental health treatment can be found in the same setting.
One could be that you have a fully embedded mental health provider within the primary care office so that they're working actually side by side, so that if a primary care doc needs seeing a patient with a behavioral health need, they can just walk them down the hall essentially and give a warm handoff and have them seen right in that moment. You also have what's called co-located situations where they might not be in the same office, but they're near each other and they have a contract or a relationship where they can refer patients directly to this other office. What I see not enough of are these types of models, however, so that when a primary care doc who's already got a full caseload and is as burned out as everybody else doesn't have that reliable referral source. So that's another area that really could use improvement.
Emerging artificial intelligence technology is also one area that shows promise, as it can help improve accessibility and long-term continuity of care. Currently, finding a provider can be a very stressful and time-intensive process. It has to be the right fit, covered by insurance, and too often patients have to shuffle through several therapists, psychiatrists, or programs before finding the right one, or, unfortunately, giving up entirely.
Some of the innovative treatments that we're seeing around how to match patient to provider include using algorithms based on demographics or personal preferences or the competence of the therapist matching with the needs of the patient. But that stuff is really not that commonplace yet. I think we're still looking at 4 basic areas where people find a therapist. It's referrals from a friend, referrals from a primary care physician, maybe looking at your insurance and who's covered under your insurance, or just basic Google searches using locators like Psychology Today. I think you see greater acceleration of these types of AI programs when it comes to physical health care versus mental health care. I do think they're coming, but one of the challenges that we see is that AI programs aren't free of bias, just like individuals aren't. So you really want to make sure that the research doesn't outpace our ability to determine whether or not they're effectively doing what we say they're supposed to do.
One newer technology that's already in practice is telehealth. Insel believes that this has been one silver lining of the pandemic. Online therapy companies like BetterHelp or TalkSpace are just some of the platforms that have exploded in recent years.
That allows people to shop for providers, to get matched to providers. It in some way it democratizes care in a way that was kind of hard to imagine before. It still can be expensive, and it may still be imperfect in the sense that maybe it's not as well developed for people with serious mental illness, but it's still a great asset and something that I think is early days for what will be a probably very different system. Largely will be online as opposed to brick and mortar.
Both Wright and Insel say that the system needs to concentrate more on giving patients the tools to look past treatment. There has to be a greater focus on recovery from mental illness, a future beyond the disorder or disability.
What we need people to really think about is how can they build the skills that they need to maintain their emotional well-being for the long term. So it's not just that a medication has a quick fix, but when I'm in a place where I feel like I can terminate from therapy, how can I then keep using those skills to keep myself well? And how can I teach those skills to those around me? I think that's a really important point, and particularly when it comes to parents, and how can you model those skills for emotional well-being to kids so that it's not, again, this sort of separate way that we think about our health, but really integrated.
Health is both physical and mental. For many, the pandemic has exposed the importance of staying on top of your mental health. To find out more about this topic and our guests, Dr. Thomas Insel and Dr. Vale Wright, visit viewpointsradio.org. If you or someone you know is struggling with mental health, find help and resources by calling the National Substance Abuse and Mental Health Services Administration hotline at 1-800-662-4357. The helpline is free, confidential, and open 24/7. This segment was written and produced by Amira Zaveri. I'm Gary Price. Coming up on Viewpoints.
Imagine if these satellites that are now monitoring and trying to see where people are trying to flee for their lives and help them out and these sorts of things. Imagine if a piece of debris just hit a couple of these. It's game over.
The growing issue of space junk. Then,
lots of programs in schools, they take kids to see a concert once a year. They should be going once a month.
The importance of exposing more ears to classical music. I'm Marty Peterson.
And I'm Gary Price. These stories in depth on your public affairs magazine, Viewpoints.
And that's Viewpoints for this week. Follow us on Twitter, Facebook, and Instagram to learn more about upcoming shows and find a library of past programs on Apple Podcasts, Google Play, and Spotify. Plus, you'll always find previous segments and more information about our guests at viewpointsradio.org. Join us again next week for another edition of Viewpoints.